name is Frank Vicini. I'm a radiation oncologist. My expertise is in breast cancer treatment. The role of radiation therapy in controlling leptomeningeal disease has changed over the past few decades and primarily utilized for palliation in those patients that have obvious CSF spread of their cancer. Typically, it's given to the whole brain. In other words, there's whole brain irradiation given in conjunction and integrated with intrathecal chemotherapy. Of course, the concerns with getting whole breast irradiation in this setting are particularly on causing side effects, but the reason why the radiation is given is actually to prevent some of the CNS effects that leptomeningeal spread can cause on the brain. Those particular side effects from the CSF spread include seizures, nerve impingement, any of a host of neurologic symptoms. And so in giving the radiation therapy, you prevent these potential very difficult problems that occur in these patients with very advanced disease. The improvements on survival are inconclusive at the present time. Some of the largest series have not really shown a significant improvement in survival, but certainly the quality of life is improved. And as I mentioned, it's typically sequenced with intrathecal chemotherapy. A lot of this depends upon the disease site that you're treating. These are generalizations, of course, but certainly how the chemotherapy is integrated with the radiation therapy, which comes first, what doses, etc., depends to a large degree on the particular cancer type. The doses are typically similar to whole breast irradiation for metastatic sites, if not slightly lower. In the past, spinal treatment was given. This goes back 20, 30 years, but currently the only patients that receive spinal treatment, that is treatment to metastases along the length of the vertebral bodies, the spinal cord, are those with gross disease that potentially could cause neurologic deficits. It's more or less given as in a palliative attempt. Again, leptomeningeal disease and radiation therapy primarily considered palliative treatment to prevent the devastating effects of the cancer in the CSF in the brain.